Hi everyone, my name is Kashif Munir. I'm the Medical Director at the University of Maryland Center for Diabetes and Endocrinology at the Midtown campus. Today we're going to take a look at our center where we treat patients for diabetes and other endocrine disorders. Come on, let's go take a look. This is our reception area where you'll be greeted by a nice, kind receptionist. Good morning. And then patients will come over to this side where you can wait for your appointment and be called back for vital signs and to see your doctor. Over here we have a special area for pediatrics where younger children can wait for their appointment, and our center actually sees patients who are adults all the way down to infancy. Then we'll take a look back into our center where we actually see our patients. After patients are checked in, they'll come back here to the triage space. That's where you'll get things like your vital signs, and if you have diabetes, your blood sugar will be checked. Our triage spaces are very nice where you have privacy, and the medical assistant will do all your weight, your blood pressure, and your blood sugar over here. We also check hemoglobin A1C here, which is a very important test to monitor how diabetes is going. As you come back through this hallway, we have some nurses that help to run the clinic and help with the clinical operations. And then we'll come back into the area where we have a nurses station. This is where we have nurses and medical assistants help us out if we need things like your glucometer downloaded, or if we need help with a patient in terms of getting medication, or if they need help learning how to inject insulin or use a glucometer. And then back here you'll see these are our spaces for our exam rooms. Our exam rooms are nice and cozy, and we have an area for the family member and patient to sit initially, and we'll talk to you face to face, and then we have an exam table where we can do the examination. Our center takes care of patients not only with diabetes but also other endocrine disorders. We actually have an ultrasound machine where we can look at your thyroid and actually do thyroid biopsies within the center. And then we have a procedure room where we can do testing to see if you have certain endocrine disorders. And a lot of the testing involves several steps and many hours, so we have a place where patients can relax and do their testing in one spot, all within the center, so the physicians and providers who are taking care of you are here at that same time. As we walk down this way, we're going to start getting closer to the education wing. Now, prior to talking about that, our center also is very closely associated with a lot of practices that are important for patients who have diabetes. We have an eye center, the Friedenwald Eye Institute down the hall. We have cardiology, we have nephrology or kidney doctors, and a wound center, all that are within walking distance from the center. So if anybody has multiple needs, you can actually find a provider right down the hall to help take care of you. We also have surgeons who come to the center. So for example, patients who have thyroid disease and might need surgery, we have surgery on site to help manage those cases as well. Here we're entering the diabetes education wing of our center. We have many different nutritionists and certified nurse diabetes educators who help patients with things like their diet. They also help patients with some of the newer technologies in diabetes management, like insulin pumps and continuous glucose monitors. Here we can provide individual sessions where you can work one-on-one with an educator and really work on your specified plan, or you can go into group sessions where you learn with other people who have similar needs. We also have many diabetes support groups for men, for women, and for teens. Our center provides comprehensive care for diabetes and all endocrine disorders, and we're committed to giving you an excellent patient experience. Hope to see you soon.